Hello everyone, thank you for coming along today and for your interest in our research study, which is Understanding Personal Shielding Stories, the voice of people living with arthritis and musculoskeletal disease. The research team is made up of myself, Joyce Fox, and Lynn Laidlaw, and we are patients living with musculoskeletal conditions. And there's Charlotte Sharp, an academic rheumatologist, and you'll hear from Charlotte and Lynn shortly. And we're being supported by Will Dixon and Caroline Sanders. So a little bit of background about our research. So early on in COVID-19, it was recognised that patients with certain health conditions were at higher risk if they contracted COVID. And guidance about shielding started in March 2020, along with a process to identify people who are considered to be clinically extremely vulnerable. Locally at Salford Royal, the rheumatology department started going through patient records to identify people, and the Centre for Epidemiology versus Arthritis at the University of Manchester began research into COVID and rheumatology patients. This included a study investigating if text mining of rheumatology outpatient letters could assist with identifying people required to shield. So the Centre for Epidemiology greatly values and supports patient and public involvement in its research. So they funded and recruited at great speed a patient advisory group to support their COVID research. In one of the meetings between researchers and the advisory group members, there was a discussion about the text mining research project, and Lynn made a comment about the need to bring the data to life and the importance of hearing directly from people who were shielding to understand people's shielding experiences and to put the data into context. So this idea grew, and Lynn and myself developed the research idea in collaboration with Charlotte. And after a long development process, it has now become this funded research project. Through its development, we've had and continue to receive fantastic support from the Centre for Epidemiology, and in particular from Will Dixon, the Centre Director and a consultant rheumatologist at Salford Royal, from Denise Faulkner, the Centre Manager, and from Caroline Sanders, who's Professor of Medical Sociology at the University of Manchester, and lead for public and community involvement and engagement for Manchester Academic Health Science Centre. And we're extremely grateful for the support we've had from our funder Versus Arthritis and their New Opportunities Fund and their willingness to fund patient-led research. So the aims of our research. We want to capture people's views and lived experience of the shielding process. So communication regarding shielding notifications and also details of how to shield have been at times quite unclear and sometimes contradictory. And this has caused great confusion and uncertainty. We want to understand what people with arthritis think of the need to shield and what benefits and risks they perceive. And we want to use the findings to make recommendations regarding how the shielding process could be improved. So now I'd like to hand over to Charlotte.
Thanks very much indeed, Joyce. So my name's Charlotte Sharp and I'm a rheumatology clinical lecturer and I'm principal investigator on this study and delighted to be working so closely with Joyce and with Lynn. So in terms of how we're going to conduct our research study, we plan to collect and analyse multiple forms of data. So we will generate data in the form of transcripts of recorded, semi-structured interviews and focus groups. And in order to make this research inclusive for people who perhaps may not feel comfortable contributing to interviews or focus groups, we have a section of the research open for people to contribute creative materials such as drawings, photographs, poems, and creative writing. To give you some more detail about this, we will recruit up to 92 participants from across the UK, so from all 4 nations. We have been fantastically pleased to have had a great response to our recruitment drive. We've now more than recruited to our interviews and 12 focus group places, which will take place across 2 groups of 6 people. We continue to be recruiting participants who are submitting creative materials. And the people that we're asking to contribute needed to have shielded due to COVID, either because they received a notification or because they chose to shield. And they also need to have a rheumatological illness that meant that they took that decision or were told to take that decision, such as rheumatoid arthritis, lupus, vasculitis. It's a very long list of sometimes quite rare diseases. Sampling is another way of describing the type of people that we're going to include. So we have paid a lot of attention to try to ensure that we have as diverse a range of people as possible. We're absolutely delighted that across all of the categories that we have considered, we've had a really wide range of participants. And when we're choosing who to interview or to invite to our focus groups, we're really trying to make sure that we fulfill as many of these different criteria as possible. So the things that we're paying attention to are gender. Women are more likely to have these rheumatological illnesses and they seem more likely to engage in this kind of research. So we're delighted to have had a great response from male patients. We are very keen to include a wide range of ethnic groups. Many of these illnesses, such as lupus, actually are more common in Black and Chinese populations than they are in white populations. So it's really important that we do capture those groups. And then we're trying to also include a broad range of ages, different types of musculoskeletal or rheumatological disease, different types of employment, so self-employed versus unable to work because of the illness, retirement, being a student, a volunteer, etc. And we're absolutely delighted with the response we've had in that regard. The analysis is another way of explaining how we're going to look at the research data and come to conclusions about it. And the type of analysis that we're going to do for this qualitative data, so written word, is what we call a framework analysis. So that means that Lynn and Joyce and myself, along with our patient advisory group that Lynn will talk to you about shortly, will devise some themes or ideas of subjects that we think will come up and will be important. So we think, perhaps as an example, that people may have been scared by the idea they've been asked to shield due to COVID. So that we come with preconceived idea that that might be important. And we also, when we analyse the findings, we'll be looking for ideas that we weren't expecting. So for the seasoned qualitative researcher, we'll be doing a framework analysis using inductive and deductive approaches. So therefore, coming with some preconceived ideas and also looking for new ones in the data. The last thing for me to say is that we have budgeted for 2 interview participants to be interviewed with English as a second language, so that with the use of a translator, and that's the only part of recruitment that we are struggling with. So if you know anybody that did shield due to their rheumatological or musculoskeletal condition and who would be more comfortable doing an interview in a language other than English, then please do get in touch. And I'll hand over now to Lynn. Thank you.
Thanks, Charlotte. So I'm going to talk a bit about how our research is from, for and with patients. And we felt it was really important to recruit a patient advisory group to help us with our research, even though it was 2 patients, myself and Joyce, that came up with the idea for the research. And what the role of the advisory group is going to help us input into the topic guide. So that's the questions that we're going to ask participants, help with the qualitative analysis, and help us disseminate the results. And we felt that that was really important because although I have personal experience of shielding, it's really great to get lots of different perspectives. And we were very mindful when we were recruiting the advisory group to try and get a range of experiences in terms of the type of disease that people had, what ethnic community they belonged to, where in the country they stayed. And we put money in the budget for our patient advisory group, and which was really important to us as well. And the aim is to have open and honest conversations and discussions with the patient advisory group about all aspects of the research. And I've reflected that that for me, this was a bit like being a gamekeeper turned poacher, and I was so used to fulfilling the patient and public involvement role, and then it felt a bit strange to me actually involving people, knowing how I like to be involved. So it was just, I felt that there was a pressure on us, on me to get this right. And there's a saying that that researchers look upon the research as their baby, and sometimes people tell you that your baby is ugly, but we really wanted the patient advisory group to be a critical friend to the research. Move on to the next slide. So I just want to share some reflections that I've had about the research, and I love this quote at the start because I think this is what has happened with us. You know, that there's been a lot of challenge, but it has been, yeah, it's been absolutely great, and just felt it was really important that our research was co-led, and it's like strengthened by our differing perspectives. And I think at the start of this process, what was important to me that it was patient-led, but I've realised that actually we are stronger because we are a diverse team. And we've just been overwhelmed by the support and good wishes of the Centre for Epidemiology and the wider research and involvement community that Joyce and I are very much part of. And we had lots of conversations with people when we were thinking about the research and writing the grant application. And I've reflected as well that I understand that I'm very privileged to have the contacts and experiences to help make this happen. So I knew the funder because I've been involved with Versus Arthritis. Joyce and I had met at the PPI group. I knew Charlotte, and just all the wonderful connections that we had made, that was a lot of hard work over the years. But I realise as well that we were privileged, and I was privileged to be in that position. And just I want to end with some thoughts for the future. So a lot of people have expressed an interest in this as there's a paucity of co-led research, and this felt like an added pressure to get this right, on top of the pressure of that this research was really significant to us because it was devised by us. And for me as well, there was this extra thing because I was shielding. So it just felt, and a lot of this, how I feel about this research came from my personal experiences of shielding and the thing that happened to me. And we feel that it's really important as well as doing the qualitative interviews and publishing about the research, to document the process of working together and our reflections and learning, and also hopefully to lobby funders to put more resources into funding opportunities, you know, so that people can do more co-led research. Thank you.